Okay. Okay, the streaming has started. One second. Yeah, now streaming has started both on Facebook and on this thing. Okay, there's a
दूसरा
small problem. One second, there's a small problem. Uh, okay. Yeah, now streaming has started both on Facebook and on this thing. Okay. Hmm. So I had changed the name of it, but the name has not changed. So,
ओके
uh, okay. Casual talks on this thing. Okay.
हाँ
Okay. Now it is changing. Cool. So I am sending you the.
आ गया यूट्यूब लिंक ना
Ha. So YouTube and Facebook, it's going on right now.
ओके यूट्यूब का डाल देता हूँ
Right. Okay. Everything looks fine, and you can also see the this thing now. Cool. So we'll start, or just wait for a minute.
हाँ मैं बस पोस्ट कर दे रहा हूँ
Just tag me also, no, so that automatically.
ये
I'll also just put it in my status. We are live
पोस्ट
now.
पोस्ट
Okay, we'll start.
इंस्टा में आया क्या
इंस्टा में मीनिंग
एक मिनट यहाँ पे पेस्ट आ रहा है बट देन वो लिंक पेस्ट नहीं हो रहा
वो ऐसा नहीं करना है इंस्टा में वो यू हैव टू यूज दैट थ्री डॉट्स एंड देन ओवर देयर वी हैव दैट ऑप्शन ना लिंक करके
थ्री डॉट्स
नो वरीज आई जस्ट ऐड दैट
हाँ आपका आया है क्या
नहीं मैं ऐड कर देता
मैं आई एम ट्राइंग पेस्ट द लिंक हाँ ओके टैग कर रहा हूँ
No, actually we cannot do it this way. Just give me a minute.
चलेगा, आप स्टार्ट कर लेते हैं.
नहीं, एक ही मिनट वाले ही लेते, कोई इशू नहीं. 1 second.
कोई आए क्या लाइव?
uh, Wait, let me just check, give me 1 second. आपको टैग किया मैंने, जस्ट देख लो एक बार. So in YouTube there's 6 live right now.
हाँ, आ गए होंगे दोस्त लोग.
Yeah, yeah. So we'll start anyways. You can just accept the tag so,
Yes.
so that people can see. So sorry for the small confusion. So let's get started. So I'll just quickly introduce myself for everyone in the live call and otherwise. So I'm Siddharth. I'm the founder and CEO of Xeron.ai, and I've been working with the area of health, well-being, and longevity since 2010. And at Xeron, we are trying to democratize digital health such that people can live happier and longer. So that's the basic fundamental. And the whole idea is how can we use AI in health to consider your holistic health, not just nutrition, not just exercise. There are about 9 pillars that we follow, and one of the major pillar that we look into is movements and exercise. So that's why today I wanted to invite my close friend Sahid. I'm sure he'll introduce himself in a minute. And the whole idea is we were discussing just about a month back about certain scenario, and that gave me the idea of small things do matter a lot. And I'll tell that story once Sahid introduces himself, and then we'll take it from there. Sahid, if you could just introduce briefly about yourself, what do you do, etc.
So, hi Siddharth, and first of all, thank you for taking me on live. Uh, so, myself, Dr. Sahit, I'm a physiotherapist, master's in community and rehab, and also founder of Inash Rehabilitation Services. So, formally introducing, yeah, I deal with patients, but informally, I'm someone who used to, work with Siddharth closely in AI Tech, and also believe that physical forms for human are actually getting integrated with tech forms. So I want to bridge between both of them. So as I think as and when we go further, we can talk more about it. So this is just a brief introduction about me.
Perfect. So, by the way, people who are live, you can ask questions live as well. And I do have some 14, 15 questions that people have pre-filled and given, plus my own lot of questions that I would like to ask. But before we deep dive into the questions around, the pain and what happens and, the small, small things that we could do, just wanted to understand why did you take physiotherapy in the first place, and what was your whole aim in getting into this, and what is physiotherapy for general population? Because a lot of people think it's massage, but that's not true. So if you can just give an idea about what is physiotherapy for people around.
That's like very interesting and the most important question. That's actually good that you asked. Just a small story behind it. The first question, all the physiotherapists, I think, around whoever has been watching this video and whoever are physiotherapists, the first question their seniors or anyone who asks is like, what is physiotherapy and why you joined? Most of the responses they get like, I didn't get this seat, I didn't get that seat, my peers have joined, I know I don't know what to do, that kind of stuff. But surprisingly, those are not my reasons. So physiotherapy was not so known, but very well known for me when I actually joined it. And the main reason why I joined physiotherapy is because of my hand itself, because which I broke it in 8th standard, and surprisingly it got fixed without even me knowing it. Then I realized like why. So when I was in my 12th, checking out the options after clearing my MBBS exams, then I thought, okay, there is some science which deals with the physical aspects of the body directly without having, most of the side effects. Yeah, it's not like it is curing everything, but it can cure a lot of things current scenarios has by bypassing most of the, elements which we take, rather be it medicine or surgery or any other stuff. In the field of medicine, there is a wide range of therapies which are available, starting from something which you can do it on your own till something which a surgeon or an expert needs to do. So then I felt, there is a spectrum in between where I can get the knowledge of what is there in the medical field and help people to resolve most of the, smaller to milder issues at their place in their own way and let your body heal your own problems before getting into any other major stuff. So that is how I paid my part towards physiotherapy, and slowly it's been like 15 years already from the date of start today. So yeah, this is how I choose my field, physiotherapy.
Interesting,
And
interesting.
one more thing, as you said, like, majority of the people used to think physiotherapy means massage. Even when I joined, I had this a lot because every patient you used to come to us, we need to counsel for 20-30 minutes. Like, this is not the regular exercise, this is not the massage, or this is not something which you need their reference to come, all this stuff. But I think last past 10 years, pretty much awareness has increased a lot. So right now, people are not thinking us as a massage therapist, and in fact, they're actually coming to us for their actual problems, and they're getting solved, I guess.
Right.
So yeah,
But even recently, I was talking to a friend, and so as you rightly mentioned, yeah, a lot of people have got awareness and they're doing it, but still, I heard from my friends that their parents and a couple of more people around still they think that it's massage. So if you can just kind of make it simplify what exactly a therapist does by an example, like where within like few minutes you could actually heal a patient rather than and it's not just massage. So just if you can give a brief idea about that.
this is actually needed because ideologies are something which are fixed by a generation itself. So talking about physiotherapy, in a very simplest terms, if you want to understand what is physiotherapy, it is nothing but using your own physical strength and physical parameters like your abilities, agilities, or your endurance, all the physical parameters which a human has innately acquired since birth. Using their own stuff and adding a little bit of support from external stuff like electrotherapy or orthotics or prosthetics or some encouragement and positive thinking. Yeah. So mixing of all these physical elements and supporting with small other electrical and functional elements and treating the conditions which are treatable by this thing. I mean, by using only physical modalities is what exactly physiotherapy is. So basically, in a one-liner, it is using your own ability to treat yourself and using your own ability so that we can treat you. Hope that makes sense.
No, that's well put. Actually, that really helps for the general audience to get a context about it. So now I just wanted to add like why we joined here for people around it. So me and Said we met about 2-3 weeks back.
Am I? Yeah.
Yeah, almost a month back at Hyderabad, and I was suffering from a shoulder pain for almost 3 months. Interestingly, like though I understand a little bit of muscles and neurons and everything, but still I was not able to release the pain, and I was eating a lot of painkillers, and I was not ready to go anywhere, right? Because I knew that it's a small pain and it's acute, it will go off. But I did put in a considerable amount of medicines in my gut, just to kind of get relief from pain. And when I did that, of course, it used to help me for a couple of hours, the pain medicines. But post that, again, the pain used to come back, and it used to haunt in the night because I could not sleep in one position, and all those things were happening. So that's when I met him, I just told him about this casually, just to see if there is any solution. And all it took was 2 minutes for him to tell me that I just need to stretch my shoulders back, and then while doing that, and if I keep my hands back and just lift it while lying down, it should release. And to be frank, that's exactly what happened. So within 5 minutes of doing so, on my own, the pain reduced almost 80-90%. And in the night, just by a little more time, I did that, and by the morning, I had no pain. And for 3 months, I've been having a tablet. So that just clicked an idea on me that this is like a very small thing, but at the same time we don't understand this, and thereby we need something where the small quick fixes can be done online remotely, and or like just by a small activity, and thereby you can save so much of your idea. So that's the whole idea and context behind which I thought, we need to understand this pain and how can we casually solve it. That's the whole game, right? It's not a serious problem yet, but if we just don't allow it, don't give it the time to heal and do proper thing, it is gonna go for a chronic pain, and then you need all kind of modalities to just fix yourself. So that's the whole idea behind it. If you would like to add anything more, Sahit, on this incident, it would be great. This was my point of view, but yeah, your point of view would be different.
Yeah. No, I mean, as in when you mentioned, majority of the therapists have this vision called X-ray vision. I mean, we usually call it in the funny way. It's like, your body, usually anybody, any living organism body have a perfect posture. There is something which is there since birth. When I talk about perfect posture, it's not necessary that everyone has that, because there are always plus and minus. Point is, when you take a stick and balance it, in the center using a band towards the right side and towards left side. Just imagine that the both the rubber bands or the bands which are balancing it needs to be in a similar tension, right?
Correct.
So, or else the stick will fall on one side. That's the easiest way to understand any muscle, in fact, any joint movement of your body, because your joints are nothing but two bands pulling from each other, each other from different sides. Whichever direction that pulls, that movement occurs. So, there is a funny story. I always used to listen. One of my, I mean, very well versed colleagues used to say, पुराने जमाने में लोगों को ऊपर देखने की आदत है. They used to pray, they used to look up, they used to look up to every stuff. आजकल के जमाने में सबको नीचे देखने की आदत है. The systems, all the work, everything. So good context, because whenever people used to be sit straight and looking up, that is the posture which everyone attain properly. So that is where your all the muscles are in balance. And as and when we stopped from that and started looking down, all our muscles have got into imbalance. One towards the lean towards one side, and the others are trying to hold them like the hooks of a suspension. So now then, when these things happen in posture, we are humans ultimately. So one muscle will get tighter and one muscle will get automatically, drained like what the other muscle is doing. So then that is where the problem starts. A lot of occupational problems, like one of yours, it is easy to identify because I know how you work. I know what kind of work you do. So that is like, easy for me to just see those points which are actually going to affect. So that is where I identified your shoulders are little ahead than it is supposed to be. So, and correcting it is not a big deal, because once you get back the position, so the muscle which is under strain is released and the muscle which is under tightness is stretched. So again the balance. So that is why I think it is said, like, the key to life is balance.
So true, so true. Both philosophically and in reality, but yeah.
Yeah.
That's so true.
So that's the reason I could have actually said it. Yeah, that's how we actually solve the problem.
Interesting, interesting. But yeah, but surprisingly, it all took 5 minutes actually to heal. So actually, so many people can actually get benefited with this. So that's the whole idea how we could actually figure this out as we keep going. So, anyways, as you know, we had kind of flaunted a form so that people could either ask live questions or they could ask pre event questions. Of course, people were not ready for live questions, but we got about 14 odd questions. So let's go one by one and then pose these
Maybe all the
questions.
live audience are therapists.
Maybe it can be, but either ways, I'm sure after the live is over, people will still see it. So let's see how it goes. So the first
Yeah, that's sure.
question is, I'm not naming the person. I'm just reading the question because there's no point of having a name around. The first question is, I have pain in my shoulder and behind my neck after looking into microscope all day. So that's one question. Uh, so basically with this we can
Okay.
just dwell that okay, the person is looking some kind of microbiology or some kind of lab work they do,
Yeah,
and
probably
they
pathologists or microbiologists or biochemists. All of them deal with similar stuff. A majority of the people in medical, including first year students of all departments, deal with microscope, especially using their own blood.
not
So
not only that, even engineers use microscopes to look into their
yes, yes, yes.
PCBs, etc.
So what I understand here is, though we, when it comes to very detailed assessments, always good to consult therapists for doctors for the further evaluation. But there is something called as occupational hazards. Whenever we have engineering terms, I think occupational hazards always deals with falling off things, falling into something, these kind of stuff. But medically, when we talk, there is something called as musculoskeletal strains on is one of the occupational hazards. So whenever we attain some posture which is deviated from the central line, as we already spoke, it always causes a constant tension on something.
Right.
But when
So
you
if
have this
we
imbalance of strength,
sorry, so if we just try to enact it, so
yeah,
let's say this is a
let's just say
microscope,
imagine
and I'm gonna
neck.
see it like
Yeah,
this
so
typically,
you
right?
have neck.
Right. So
Yeah,
the neck
and
is
one hand. Uh, so here I want to tell, when you're actually enacting, you put both the hands on one microscope, right?
right.
It's usually one on the bottom and one on the top. In order to
But
move the platform and in order to, move the
right,
focus ring.
right,
It's like this.
right.
So because of this, one is constantly on top, holding your muscle is actually holding your entire arm constantly on top, and the other is resting and moving it comparatively on the table. So this actually causes a lot of tension from your shoulder till the neck. So because these are the muscles which have been active for long. So there are two ways you can tackle this. Because occupation related hazards, there is one serious problem in it because you can't avoid your occupation. That is what will feed you. So if I tell go and take rest, that might probably be a bigger loss than muscle strain. So so occupational hazards needs to be dealt in a specific way, like giving you increasing your rest periods. Like for example, if you have an hour of work, take a break of 1 minute every 10 minutes. Usually they follow 20-20-20 rule, but then I suggest in hardware issues you take 10 minutes to 1 minute rest. So whenever you are resting for a minute, that relieves the tension in those muscles and they regain their strength back and energy back. So they can work for another 10 minutes. And I think like 30 seconds or 1 minute is not a big deal when you are working for longer hours. So this is one way to prevent it. And second, if it is absolute necessary, you can have some supports. A shoulder support. There is I don't know, there is a FOMO about supports. Like, whenever someone is wearing a support, they feel, isko kuch ho gaya. या कुछ हुआ तो ये पहनना है. So we always have that thing like, I don't want to wear a corset because I have my back fine. But imagine you're bending for like 2 to 3 hours and doing some stuff. Corset will prevent to get get rid of that pain which didn't even start. So similarly, you can use for this specific condition. One is to strengthen your neck and shoulder muscles by using something called as static exercises. And before working, just push on to the wall and wait for a few seconds so that the muscles will get recruit more. The muscle fibers will act. More muscle fibers will actually act, and give some rest periods in between, so your muscles won't strain. So if your muscles are working good, attaining posture is fine, and you have enough rest periods, you'll not end up having pain.
So that's the
But if
preventive
you
aspect
have
of
pain,
it.
yeah, if you have pain already, then if it is milder, it can be solved on your own by giving it some rest and doing some static exercise like pressing on your hands like towards back, right
Like
and
this.
left. Yeah, so you pressing, you're not supposed to take it back. You're just supposed to hold it. So where your
Oh,
neck muscles will be in tension, but your neck is not moving.
moving. Okay.
So in all directions you can.
So
So
it's almost like
this
this. So like,
is,
and then
yeah,
like this.
a little overhead so that it will put more pressure on your neck
Like
rather
okay,
than your back.
right. So that would help to
So
a good extent.
yeah, that would help to relieve or strengthen your muscle a little bit. But if it is more than moderate or severe, it's better to get evaluated as usual.
Right. And
Yeah,
in
static
this,
rest.
sorry, in this, is there any other way to relax it using, say, cold water or warm water or something like,
Yeah,
probably,
but when you are at work,
no,
things
post.
like that are not possible.
Once you come
Post work, yeah,
after.
you can. Just imagine if it is a very acute pain, like, today you got a damage or tomorrow or yesterday, like these 3 to 4 days, it's preferably you can just place some ice over it and that will reduce the pain. But if it is for long, like maybe post 3 to 4 weeks or 6 weeks, then you can use some hot pack to release the tension and then do the exercises. But at the end of the day, using the modalities is just to relax. They are not to regain your strength or anything. But yeah, that will help to reduce your pain and you can do your exercise much better.
Oh, so just a question, interesting. So let's say for example the person has worked through the day, they come back to their homes or this thing, so they can just. I thought like having a hot shower would help, but you told to use a
Ah,
cold towel or something. So what's the logic behind it?
so hot shower you said.
Yeah, hot shower, hot towel,
Yeah,
same thing.
so
Yeah.
yeah, there is some what do we say, some confusion throughout the world in this when it comes. That's because whenever you put hot water on yourself, your body relaxes. That's nature. Sorry. So fine. But what we are talking is a very precise and very specific point and controlled way. So putting up hot shower might relax your whole body, but your whole body is not as tensed as your problematic muscle, right? So when your muscle have little problem or little stiffer than the rest of the body, when you put hot water or anything, your body relaxes, but your muscle won't relax too as your body. It's not in balance. So that is what we suggest. Use hot moist pack. That is like dip a towel in warm water or hot water, not beyond 42 degrees, and then put it so that it will go till the hot the heat will slowly dispense till muscles. There the muscle need to get relaxed, not the skin. So taking a hot shower will help, but taking a hot pack or not the dry pack, the moist pack will help much better. So that is one thing. And second, sleep. Sleep properly, avoiding your any other stuff after a long day of work, because your body is not a machine. Even though if it is, it needs some rest and food. So have some food and sleep. That will solve a lot of problems along with the other stuff which I have told. So that I think can make the viewers life better.
Interesting. So, on a similar
Yeah.
line, there's another second question around, which tells that it looks very similar. My shoulders and neck hurt when I sit for long and study.
Oh, here though the condition is same, what he or she needs to change is the way they study. If you are studying and if you are getting neck and shoulder pain, there are two reasons. One is either you are studying too hard. That's because your many of the people get we have this once we did a study in college students. It's so funny to find out 80% of the students have neck and shoulder pain for 15 days. That is like 5 days before exam and during exam 10 days. And after that, everything they get resolved automatically. The reason behind it is when we are studying, these people tend to study like this or using phone like this. Wherever they are looking down, these are all the same problems. Looking down and doing. Or some usually study in a different pattern, like we can't even analyze. They are like legs up, and maybe they feel it will go better into the brain. Putting 2, 3 pillows under the neck, or probably reading when they are on the tummy, sleeping on the tummy. So all these kind of awkward postures will result on that pain for sure. So correcting their posture will help a lot. And secondary thing is stress. If you are, I would suggest study like from 2, 3 months before rather than 2, 3 days before. And if they are doing from 2, 3 months, then probably they should stop studying for a while and take rest, because our trapezius, this muscles what we call, they are called as stress muscles. The reason behind it is the moment you think, you have a small thought of your stress, and the first muscle to get activated is your trapezius. So whenever there are exams and all stuff, or when you are studying too hard, so that actually brings out a lot of stress, and that also can cause neck and shoulder pain.
Interesting.
Yeah. So correcting the posture is a perfect example, and relaxing, I think it would help at least 80% of it.
Got it. Got it. There are a couple of questions now in live as well, but we'll go for live in a little bit so that we cover
Yeah.
almost all the things.
Sure.
Uh, so this was one question. Now there's an interesting question. I'm not sure who asked it or what it is, but pretty interesting question as well. How is chiropractor different from a physiotherapist? One, and is it an NMC or any body approved sciences?
Okay, so it's a very debatable topic
I
as
know.
you bring
That's
out
why
the
I took it
chiropractic.
down.
So I like to have such fun and debatable topics because okay. So talking in terms of facts, there is in India chiropractors are not officially recognized through any other bodies. Neither do have an official what we say degree or something. So that is one thing I want to make it clear.
Okay.
As of now, at least, it's a straight and bold view because that is how it is. I don't think in majority of the countries they are recognized actually. This
Oh.
trend started from US and European countries, mostly not even Europe, like most of the US countries. Where they are. Let's just imagine in India we have something called as bone setters,
Hmm.
right? That's the same as chiropractics in a way. Maybe some chiropractics might get hinged out of it, but then the fact is, setting up the bone in a very professional setup or in a layman setup is still setting up the bone, which is something like, not acting over the muscles around it, neither your sympathetic and other nervous stuff, neural stuff, which is controlling that, your functional adaptations which are there throughout your life, your body adaptations which have been happening since long time, and setting it up immediately also have a lot of negative issues too. Though there are some conditions which we also use, but they are not. We are not like under the term of chiropractic. It is something called as plus thrust. So it's similar techniques where chiropractors also use, but if someone who is a therapist and they are using it, they might have a lot of knowledge in terms of overall body. They can fix it much better. But getting it as a chiropractor without having an overall anatomical view might actually cause a lot of problems, because it's simply like, you take a stick, it has been bent over a period of time. You just want to make it straight by snapping it. Probably some might have gotten straightened and majority got broken. So, whenever we talk about medical science, we go very strictly on evidence-based practices. If we are putting some tens to you, or if some medicine is given to you by anyone, if surgery is done by some surgeon, everything has a huge and crazy research done behind it and putting it up as a backup. Even though they can do it on their way, but they don't do it. The reason behind it is, even though all the humans and anatomy are same, but the way they function are totally different.
Different.
So when we talk about chiropracts, they deal with one particular system called skeletal system. A simple example, like if you have a neck issue and chiropractor might adjust it, and you might feel very relaxed at the moment of time. But slowly, after a day or two, majority have complained that their neck became stiff later. The reason behind it is the moment you snapped it, the tendons also get stretched in a very quick response. That's the tendon response, what we call a tendon reflex. So that releases the entire muscle too. But the negative part is that when it is in spasm, that muscle tends to contract more again because your body is already in spasm. That means it is protecting your muscle to, in order not to tear it. Now then, chiropractically, you adjusted it, only the bone, the muscle which is already stretched and protecting got stretched again. That will, worsen the condition.
Right.
So my views about chiropractic is like, trust what physiotherapists use, have a lot of backup behind it for sure. And anyone who are skilled can use it. It's not, गर्दन तोड़ेंगे तो direct paralysis हो जाएगा types. In controlled environments we do, and they fetch great results in terms of people who have additions. But if you coin the term chiropractics in India, at least for now, because I'm in India, so it's not officially recognized, and I don't think it has a very well research backup also.
Interesting. Interesting.
Yeah.
And physiotherapy comes under NMC, RCI, or something else?
No, so this is another debatable topic. But recently, yeah, physiotherapy has become so huge. It was always, but it was not that well versed into the outside world. Like US and other states have APTA, American Physical Therapy Association, and other stuff. India, right now, today, if you talk, it has come under in nationally recognized branch. Allied Health Science bill has passed under that. So before that, it was controlled by something called as Indian Association of Physiotherapy. So every state also has, almost half of the states have their own governmental council, like Maharashtra has MSOTPT, and Gujarat has its council. And so now then national council is being formed, so all of them will come under that roof. It doesn't fall under NMC because NMC is National Medical Council, officially only for people who are under MBBS and their domains, like how the Dental Council or INA, Nursing Association, or Pharmacy Council of India is there. Like that, we'll be falling under this council rule. But till now, we are operating under IAP and the government councils of states.
Interesting. Interesting. Now, going back to the next question, there are quite a bit still pending. So we've just finished three, I guess.
Yeah.
I've recently undergone an anal fistula surgery laser on Jan 7, 2025, and still I am getting pain a little bit. How can I overcome this pain with diet and exercise? Is it possible?
Okay, here I just want to make sure one thing. So, when you term some medical conditions, right, there are two pathways of pain there. One, because of the surgery, if there is any other muscle involvement, and because of that, if the pain is getting severe, if the pain is persisting, then physiotherapist might help. But if the pain is due to the surgery or due to the medical condition itself, that I don't suggest to go to a therapist first. Better to consult your medical doctor so that that thing will be ruled out. Because as I already said, medical line is a huge spectrum. So everyone have their roles. So it's not like physiotherapy. If we are able to treat pain, that doesn't mean we are able to treat all the pains.
Right.
So that's also something people need to know, and even therapists need to know. So for this question, I would suggest get a medical checkup first from the surgeon, surgical point of view, whether it is actually due to the surgery or no. But if it is in terms of not the surgery, but in terms of physical pain, like any back pain or any related issue because of that surgery, because their posture has changed, that I think I will be needing more of details to evaluate. That consultation will be a better option than an online session.
Got it. No worries. So,
Yeah.
suggestion is better to reach out to you in a consulting or go and check with the doctor first and then come back.
Yeah.
Makes sense.
Yeah, because it's always good to keep it crystal clear from my side what I believe.
Exactly.
Because I have seen a lot of people, they visit like, sir, you said like these pains are reduced. So now I am having pain because of my stomach ache. Please reduce it. And surprisingly, there are some businesses also where the people are taking them in the name of either physiotherapy or other therapies or alternate therapies and earning good money, eventually ending them in the hospital ICUs. So these
Makes
are some facts. But yeah, so that's why I want to keep it clear.
makes sense. Makes sense. There's a next question. Can you suggest ways to improve posture? Interesting question.
Yes. So posture is something which can be improved at your home on your own pace by everyone, because a posture is not something which you attain. Posture is something which is already there, and there are different postures which you actually attain. So the natural one is something which you have it from birth, and slowly develop based on your work. So there are 6 steps which I can suggest. I usually suggest my patients from IT especially because they have the worst postures ever seen. So, stand in front of a mirror and check for these 6 points. You will get to know whether you have a good posture, better posture, not so good posture, worst posture. That is your eyes to shoulders, whether they are aligning or not, shoulder level, whether they are equal or up and down. And when you stand towards one side, the shoulder, whether it is forward or backward, your what we call it as a lumbar curvature, like lower back, whether your lower back is curved, over curved, or flat. So curve is natural, over curved will fetch lot of problems, flat back will fetch more problems, and knees, whether they are near, far, or straight, whether your ankles outside, inside, or straight, and your hips, whether they are up, down, or front or back or in center position. So these 6 points, if you consider, so if any of these are deviated to any of the side, that will cause a postural problem. So now then, for example, if you don't want to get those problems, or if you have slightly or moderately you have the problem, you want to correct it. For every scenario on this, these exercises which I'm going to say will work. That is, one is your chin tucks, where you're taking your chin and tuck it in, where you're taking it only behind. So that will help you strengthen your neck muscles. And then your shoulders, pull back and up and hold for few seconds, like 5 seconds, and release. So this will maintain your shoulder positions. And for your back, bending forward and bending backward for people who are able to do it, or for someone who is not able to do it, by lying down on their back, they can actually, tuck their tummy in and press on the bed. So that is one exercise which can help. And standing straight and stiff, sitting straight and stiff, and standing straight and stiff for a while, and balancing, what we call the last one. This is one of the easy looking one, but the scariest one. That is like, balance on one leg while lifting the other and closing your eyes. So you don't need to close your eyes in the first instance. Start with balancing on one leg slowly. So this will start correcting your postures. So there are a lot of other exercises also. If I start telling, like, I think, well, podcast will go up to a lecture, which I don't want to mention. But these things, especially straightening up your spine, straightening up your shoulders, keeping the chin tucked in and looking straight, back stiff, knees stiff. So this stiff posture is one thing while sitting or standing, and the rest of the exercise, this will help you to keep overall posture in a good form. So if there is any other thing which is more than that, then I think it's better to consult any therapist so that they'll correct it in a micro level way.
Right. Now, because you're talking about posture, just a related question. Can you tell us about what exercise we can do to help maintain posture? My body feels tense when I try to keep my posture.
Okay, so now till now we spoke about posture a lot, posture, but there is something which I want to mention, that is the flexibility of your muscle also. That is what keeps your posture straight. So if your muscles are stiff, they are tight, they won't. I mean, joints are stiff and muscles are tight, your posture will change. The cause. So stretching is one thing which needs to be done prior to any of the postural exercises. So because of stretching, that is where you get the actual length of the muscle and actual space to play around with it. So it's imagine like you just take a small ball and put it in between two bars. No matter how much you try, it will only move that 1 mm. So it will feel stiff. So naturally, there is some person called as Ulrich Landl. So he has invented a machine called matrix rhythm therapy. So which is being used quite a lot these days. So he found out something like our body cells have some vibratory state. So within that vibratory range, the muscles are nice, and beyond that, they are loose, and less than that, they are tight. So how to check it? You just compare with the other body parts. Like if it is hand right to left, right leg to left leg. So compare it with opposite sides and see whether they are equal and equally full or equally less, or there is a difference. So wherever there is a difference, try to stretch those muscles properly in a proper way. Proper ways can be found in everywhere, and or else you can just get to meet one therapist. Once they'll show you how to do it, but stretch them properly. That is how you feel more relieved from the tension, and then maintain the postural exercise so that you won't feel that stiff more. Because I suggested you to sit like this. But imagine if I'm stiff and sitting like this for long, that eventually ends up in problem only. It ends up in trouble. So stretch your muscles, give them space to play around, and then correct your posture. That will be the best course of action.
Nice, interesting. So I guess we should go for the next question so that this thing. There's again a very interesting. Okay, before we go, there's another posture which is very related. So it could be quickly closed out. So I'll just bring
Okay,
that first.
sure.
Do posture correctors that are available on Amazon work?
No. Yeah, they
So
will
guys,
work.
don't
They
buy
will
it.
work. They will work, but not to maintain your posture, rather to weaken your muscle and get more trouble. See, having this postural characters is like basically supporting your muscle or body from external ways. It is
Right.
needed when you are in trouble, but when you're normal and you're using it, then you'll end up in trouble. So, if you ask me, I'll say directly no.
Got it.
Uh, yeah, but don't confuse that with orthotics, because orthotics also support, but they are in a very supportive and good way to work. Postural characters are like good business for IT people. Hopefully, I think I'll also start a business on that. Might earn more money.
Count me in as an investor. Next question. My mother has severe osteoarthritis. Can exercises at home help relieve her symptoms?
Okay, osteoarthritis is a very common problem, especially when you are past your 40s, fourth decade to sixth decade, and more. So, what I suggest is if it is grade 3 or above, better to have a surgical consult. And if mom is like fit and fine to undergo a surgery, and preferably, I think they will suggest. But if she is able to walk more than like 1.5 kilometer in one stretch, and the pain is, see, osteoarthritis pain can be elevated using physiotherapy for sure, by increasing the strength and using some electrical modalities. But at the same time, there are some things which you need to keep it in mind. Like if she is not able to take past 10 to 12 steps, like elevating her pain is what we can do, but not improving it much, because that might have a negative effect also. But if it is in such condition where her mom is or his mom is able to walk, able to move around, but still have pain and other stuff, then I think yes, physiotherapy exercises and even electrotherapy will help a lot. So I have seen a lot of cases whose pain has reduced to 70 to 80% within like 2 to 3 weeks.
Nice.
So, but so there are a lot of a lot of parameters to consider before suggesting the exercises. But
Exercises.
few common exercises like pressing the knee on the bed, so static knees and I mean static hands and static quads which you do. Those can be done like that. I suggest to do for everyone because they don't cause any harm and they will maintain your muscle strength and relieve little pain. But if it is severe, then please get it checked and take an evaluation done, and then we can.
Interesting. Again, just related to osteoarthritis, just as a continuation, I know you have given an answer partly on this. is there hope of pain relief in stage 3 osteoarthritis?
Yes. See, there is a hope to reduction in pain. I won't say pain will go 100% because it is stage three. That means almost the bone corrosion has started, and the cartilage is also most probably damaged. That is how the stages are defined. So, but then if you are talking about elevating some pain, yes, at least 50 to 70% pain can be elevated based on how your body is responding for sure. But taking out 100% pain, I don't think it's possible once it is severe, because even if you can take it out by rest, the moment you start back your work, it will reappear again. In that terms, I am telling. So if it is severe, then yes, for sure the pain can be elevated. For sure the strength can be increased, but for sure it's not 100% cured.
Right, right.
Yeah.
But there is still some hope.
Yes.
That's good. Next question before we go to other questions. This looks like a one which you can answer very quickly. Role of physiotherapy after TKR, total knee replacement.
So probably it's kind of like have you ever heard of a how I mean have you ever heard of samurai swords, the katanas? So
Yes.
there are three people who make it. One who gets the alloy, the second one who forges the material, third one who polishes it. So once the surgeon got the surgeon gets them out of the surgery, so we are the one who forge it and polish it back again. So we have, I mean, being a physiotherapist has a huge role post surgical TKR, and in fact any other replacement surgeries, because the once TKR is done, it's simply that the problematic part has been replaced completely. So the core problem itself is solved, and it is 100% solved. So surgeons, they do it very meticulously, and they check inside the surgical table. I mean, on the surgical table, whether it is moving, the knee is completely moving or no, there are any restrictions or any other stuff. So once if the surgeon has sent the patient out after TKR, that means their knee has become nearly normal. The problem what they face is because of the incisions, the muscle weakness, and other stuff which has been there. So that needs to be corrected, and which is done by a therapist. So yes, TKR physiotherapy has a very huge role and a primal role.
Right, right. But then, just as a continuation, this is from my side. Like after TKR, how long? So because one of the pain points for a lot of patients, especially in urban India, may not be maybe not be true for tier two or tier three towns. Uh, is that how long should I go to a physiotherapy? How many sessions should I take? But most of the time, we also see that 1 hour sessions, even per day, 7 days a week, still it's not enough. So how do they do this maintenance activity so that they have the best effects? And then we always know 80-20 rules. Within few 10 sessions, 80% will get resolved, but the last 20% would be the niggle pain, which will keep being there for a long time. So how do we help in such cases for TKR?
Yeah. So when we talk about post-surgical recovery, we all have one thing called as written pattern, the book pattern, where these many weeks, like 4 weeks of this and 2 weeks of this and 6 weeks you will get. So, but the point is that doesn't work for everyone. Everyone has to be tailored for their exercise and rehab. So post-surgery, it is suggested like within the moment your anesthesia is faded off, within a day we actually make our patients stand, especially if you talk about TKR. So that is how actually post surgery immediately the once the anesthesia is taken care of, like after like 6 hours or 8 hours, the patient is made to stand. That is how fast the rehab starts, in fact. But as the external factors and internal factors, like for example, your muscle strength and how have you worked before undergoing surgery, what is your respiratory capacity before and after right now, these parameters and how willing you are to do, and how much you are able to bear the pain. Like you said, like urban people pain tolerance is very low. If I have seen farmers who had a, I mean, it's very rare to see farmers who had a knee replacement, but I have seen farmers who had a knee replacement get back on their feet and walking within 2 weeks. By the first week, we used to suggest, please don't get up so quick. even though you are able to, but then they are like by the second week they are already off the walker and they are like, sir, I'm fine, I'm walking. There is little pain on my stitches that will fade off because past 10-15 days they'll take off. So the our only concern is also the stitches itself. Because if your muscles is strong, the knee problem is solved, you can get as get on your feet as fast as 2 weeks also. But then are you actually in that fit state, like your cardiorespiratory endurance is to that level, or your muscle strength is to that level, or did you go to prehabilitation where before getting surgery, are you trained for what all problems you're gonna get? All these parameters will define how much you need, how many months you need. Probably if you don't do any of the stuff and sedentary and not gonna do it, it might take you lifelong physiotherapy and still you will be able to, face some issues in your knee after solving everything.
Right,
So it's
right.
very subjective. Yeah, at the
Subjective.
same time, if you ask me a rough for a normal individual with a good amount of strength, it will take 2 to 3 weeks to get down and start walking, and by around 6 to 8 weeks to be on toes completely. When we consider 40, 45 years old, so age factor also determines, whether the timeline goes forward and or decreases.
Right,
Yeah,
right.
I hope I answered that question.
Yeah, you have. That looks perfect. Again, we have got more questions, so I'll just try to go faster. I'm a house surgeon, and as part of my duties, I end up having to walk more than 15 to 20,000 steps in a day. During the weeks when I have to walk more, the lateral part of my ankle starts paining. I end up having tenderness and edema. It gets subsidized with immobilization and crepe bandage and rest only. This keeps alternating between my two ankles. Can you suggest how I can manage this as walking is inevitable in my profession?
Yeah, absolutely. I can totally understand that question because a lot of my friends are, I mean, in the medical field, and we know how much we actually walk. And ankle problems are one of the major things. So, the given information, I can't suggest 100% result, but I would suggest get an X-ray done first, just to have sure if there are any spurs or anything. If nothing is there, if it is ruled out, just change your footwear to semi-soft or soft based on your ankle. Get a footwear assessment if possible. That would be a great stuff because walking is inevitable for sure. But we always have this thing also, like wearing soft soles will help us a lot, or wearing hard soles, but it is kind of like whatever soles fit for your foot help you a lot. So wearing, most probably if you are getting it when you are working and whenever you are taking rest, it is getting reduced. It's due to overworked ankles. There might be some inflammation inside. So having done something called as contrast bath, like putting your feet 2 minutes in some warm to hot water and 3 minutes in cold water, or vice versa, and doing it for 5-7 minutes to 15 minutes. That will reduce a lot of tension, and changing the footwear will be a good and ultimate option if there is no internal problem with the bone.
Interesting. So,
So
so
yeah,
easy is to use alternate hot and cold water, to
yeah,
in few
and
minutes,
changing the footwear.
and
Changing
changing
the
the foot.
footwear is a must. Is a must. At least if you can't change the footwear, you can add additional insoles. There are a lot of available cushions right now. So one which suits you. If it is not, I mean, even though if it is a bone spur, still the treatment is the same. Other than that, you'll have some of the medications, but ultimately, having a modified footwear and adequate rest
Can
and
help.
this contrast will help you to relieve pain a lot, and even reduce the amount of problem you have right now.
Right. But this is now an interesting question because I'm just continuing the same question now, because you brought in the footwear. Uh, so we have seen a lot of people buying this 300, 400, 500 rupees footwear, and they'll use it for 2 years, 3 years, if I'm right. So what do you think? Because as we know that our whole body is actually resting on those footbeds. So what's your suggestion when it comes to footwear, and should people really invest in a good footwear, or 300, 400 footwear works for them? What do you suggest?
Yeah. So it's a good question. So forget about everyone. Let me talk about myself. You might probably see me wearing clothes like Bhikhari, but you always see me wearing a shoes. You all have already seen, I think, which are like quite costlier. I always invest on my shoes because investing on your shoes and investing on your what we say footwear is as equal as you're investing on your makeup or beauty kits, because the way your face values or beauty matters for the outside world. Having a good footwear is always important for your inner world, because every problem with your ankle or foot will slowly climb up to all the body parts up, like your knees, your hip. It and disrupts entire your kinetic chain, what we call as. Why I'm telling here is because you see a farmer or you see a laborer, they don't have these issues because most of the time they are barefoot or they are in uneven grounds working from childhood. But for urban setup, what we are right now, the one and only sensation the foot knows is a flat and soft one. The second sensation is a flat and hard one because of our tiles or marble or something. Other than that, hardly we have experienced how our grass feels, how mud feels, how your rocks feel. If you really, I mean, if you really want to try it out, one fine day, just take off your footwear and try to place your foot on the tar road or cement road with the small stones. The moment you put, you feel so much of pain that it will directly hit your head. That's because your food are sensitive. The reason why God made such sensitive food is because food are capable of absorbing a lot of nutrients and other stuff from the ground itself. That is how we are made. So that, and also being the smallest parts of your body, it actually carries the entire body weight. So imagine it is like I'm placing one pin and 100 kilos or 50 kilos on that pin. The pin eventually needs to get inside, but we are not going inside, right? Because our foot is made in that way. Like it has cushion, it have arches, it have smaller muscles, it has smaller bone structures, and it's one of the most complicated structure of our body. In fact, ankle and foot, what we call. So, if you really are accessible, I would suggest at least an hour or two walk barefoot, especially in gardens or such, not on the tar roads or cement roads, you might end up having boils, but uneven surfaces or beaches or any other stuff. But if you are not having access to such stuff, at least please invest on your good footwear. And good footwear is not always a costly footwear. Good footwear is something which fits for you. And second, if you are taking it cheaper or costlier, doesn't matter, but you need to keep on 6 months depending on how extensive you use it.
Makes sense.
So wearing it for a long time is basically the foot chappal will have your foot imprints on them. So basically they are not doing any good. They are directly touching the ground itself.
Ground itself. Right.
So yes.
Makes sense. Makes sense. Going forward, what are the methods to improve mobility and prevent injuries in elderly?
Yeah, so when we talk about elderly, there is a whole new concept for them, which is called as active aging or mobility-based aging, what we call. So see, for us, we already have an innate strength. Everyone, in fact, like the life cycle of human is like in childhood you have the most potential, in adulthood you have most strength, teenager and adult, and then moment you get start becoming a little older, your strength slowly declines based on whether you have worked throughout these years or no. So in elderly, it's not like I can tell them to do how we do like biceps or this or that. No, we need to concentrate on overall generalized exercises, and don't tell them as if you are doing exercises. Just give them activities which are considered, a normal life for them. Because just imagine the irony: 80 years or 70 years old or 60 years old, a 20 years comparatively a very newborn for them, going and telling them, you need to do the exercises or you don't have strength. They'll be like, when you are not having strength, I used to lift you and walk for 10 kilometers. And that I always listen from my grandfather also. I used to, not anymore. But then the point is, it's not like they don't know the value of strength, because they have lived the life which we are living currently, like about 40 years back itself, when we are not even born in this world. So they actually know better stuff, and they have done a lot of stuff than us. That is the reason they are stronger in their old age. But as we say, psychologically, this is thing, but physically, in order to improve mobility, don't just put a pressure on their head like do this exercise or do that exercise. Give them the tasks or activities which should include all the joints use and something which they are interested in doing. Like, a lot of people from rural areas doesn't face these problems because they have this habit of playing with their granddaughters and grandchildren. Their strength maintained because, imagine if you are lifting like 5 kilos, 4 kilos, 10 kilos and lifting up, playing around, your body is mobile.
Right.
In urban population, we don't tend to leave our children also with them. And right now, we are not having children also, a lot of them. They are want to stay away. But then the point is, ask them what they can do and make sure all the joints are moved from the small ones to larger ones in full range.
Right.
So once the moment it is said in old age, the moment you stop, the moment you decline and die. This is a fact. The more mobile you are, the more length and farther you go. So make sure the walking is good. Make sure they are actively included in doing things. Make sure all of their joints move, and the mobility will increase drastically.
Interesting. Very interesting. We have 4, 5 more, but before that, let's take some live chat.
Yeah,
Uh, so in live chat, there's one specific question. Due to constant head-down position while using mobile phone, my neck muscles get stiff and painful. What is the correct posture while using mobile phones?
I would suggest don't use your mobile for so much. Funny things apart, because few years back there is this new syndrome which got out. That's called Facebook syndrome.
Okay.
That right now has a lot of names, but then the reason why it got out at that time is because when Facebook users increased, that is where this particular posture of looking down on mobile and having a Facebook chats have started, that eventually grown now to Instagram, X, Twitter, all of that stuff. But then that syndrome itself is named as Facebook syndrome or mobile phone syndrome, and now multiple names have come up. See, I would suggest always take rest in between while using mobile, and always place your mobile in front of you rather than down. So that would be easier, because if you are placing in front of you, you're not straining your neck, but instead you're straining your shoulder. Eventually, you'll get it down. So keep a timer to track your mobile usage, and at least every 15-20 minutes, you take a 5 minute gap. That eventually will release your pressure and also prevent a lot of neck problems. Recently there were studies which are suggesting nearly 38% of your neck problems, especially including spondylitis, what we call tingling and all this stuff, they are due to your extensive mobile use or extensive reading and laptop users. Laptop
Right.
users are also less compared to mobile users, because if I take 100%, 68 to 70% occupied by the mobile user market.
Right.
Because uh, see, there are few problems which occur to your body and can be corrected, and there are few problems which we get on ourselves and need to be corrected on our own.
Correct.
So if I take a hammer and hit on my hand, and I want the pain to be reduced, and again after reducing, if I hit again, so my suggestion would always be don't hit on the hammer if possible, or wear a glove if you are really into hitting yourself.
Right.
So using mobile is also same. Reduce the mobile use if possible, or at least keep it in front, or keep it on a stand, or don't sit in that awkward position like this. Rather, just lift up a little and then watch, and keep a little more distance from your mobile. So that would help to reduce that stress.
Right. So one of the things, reducing mobile phone, I don't know how far it is feasible at this current age. But then what I do is, just correct me if I'm wrong, is that I have a sofa, so I have a hand rest. So in that hand rest, I keep a stand like this
Yeah,
and keep a
yeah,
mobile phone on top of it, and then just scroll. So that means I'm not
that would
bending, or shoulder is also okay.
exactly. So such things can help if you are really, need to check your mobile constantly. If you are into that constantly, majority of these binge watchers, then you can use such supports. So that will help you to be on your mobile at the same time, not cause much of trouble. But I always suggest better to reduce the mobile usage.
That I don't know how many people will take that suggestion,
It's
but
just a suggestion. It's just a friendly suggestion.
yeah. Okay. Anyways, one more live question. Okay, some help for diabetic patients. So it's a very generic question. So probably how exercise or how a typical this thing could help diabetic patients. If we can just put some light on that.
See, it is proven fact that your physical health and your physical fitness directly improves your diabetic profile. Like, for example, not one, not two, like many researchers have stated, like, if you are physically and mentally fit, so the chances of having troubles with diabetic reduces more than like 60% to 70%. So, exercise do help for diabetics. It's just that they need to do it little differently because there are these glucose spikes and drops. So you need to monitor them and do the exercises. Mild to moderate exercises like cycling or swimming or mild jogging or walking for long and some static exercises. These will help uh, a lot for any diabetic. There are many instances where nearly diabetics with more than 260 to 300 GRBS have been able to maintain their blood glucose levels within the normative ranges or near the normative ranges. And there are even instances where people started reducing, use of insulin when they are properly into exercise and fitness. So exercise does help, but I would suggest these at least start with mild to moderate exercise, which I suggested right now, and walking or jogging and swimming. If they can do, these are the best ways to start the exercises because they are overall body worked out and help to maintain your, because it's very simple. When your muscles are tired and they'll consume the amount of glucose or they'll consume, food from within. So you'll automatically have control within you. But if it is stored and just be there, so control is lost.
Right.
Yeah, though it's like diabetics, I mean, diabetes you can't prevent once it is there, but you can keep all your stats within and just for example, my dad, I suggest exercise for my dad. He's a diabetic since for 38 years. And he had undergone bypass with 3 grafts with 98% blockages. Till today, he's 61 and he goes literally on bike for more than 200 kilometers on his own and come back
Nice.
without having any trouble, and he does all the exercise. He only complains of two problems. Like recently, when I'm climbing, I'm having a little knee pain. And his diabetic profile, like if you see for 1 month, not even more than twice or thrice, there is a spike. So it also comes to the dedication how you're doing it. But exercise for sure helps and it is directly proportional to your reduction or maintenance in diabetes. Rather not reduction but maintenance in your diabetic profile.
Okay. Nice. 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 Interesting. But like when you exercise, there will be live changes in glucose level. So how do we monitor the spikes at that point of time? CGM is one option, but that is not affordable to all. So how can you? How is there any signs that you should look at from the body that it gives, or something that they could look into?
Pardon? Can you repeat the
Now,
question?
when you do an exercise, especially for diabetic people, the sugar levels will be fluctuating in live, right? So
Yeah.
now, when that fluctuation happens in the live, not many would have a CGM. GRBS is not possible that time. CGM is possible, but CGM is not affordable, and you can't keep wearing all the time. So is there any signs that they can look into the body so that they could
Yeah.
stop before it hurts them?
Absolutely. So, see, what I wanted to tell is imagine like 30 years back when there were no CGMs, but still there were diabetics, right? So, the technology kept on increasing so that we can track much better, keep a much better monitoring systems, act much faster and quicker, all these things. But the core always comes to the signs and symptoms of the person itself.
Right.
When there is a drop of glucose level or when there is a hype of glucose level, your body produces certain responses automatically. So especially when there is a drop in glucose level, you start feeling that blackouts if it is severe, or you start feeling restlessness. Initially, the first sign is like you start feeling restlessness and you start feeling lightheadedness also at times. but lightheadedness is mostly due to low BP rather than your diabetics. The diabetes creates something which is a peculiar sign is hypoglycemia is the condition what we call. You feel you have been drained and slowly it ends up into a blackout if it is severe. But the moment you realize, you have this sort of disorientation, a little one, so that keeps a warning sign that you might have a glucose down or inward spike, and or if you are too much restless or having this irritable or tension kind of feeling, can suggest like your glucose has been little spiked up. So, because your body, your brain only consumes glucose. Other than that, it doesn't take anything, and it consumes a lot. Like though being 2% of your body weight, 24% of your body surplus glucose is directly consumed by your brain. So imagine like being 2% of your organization and consuming 24% of its grants. So it's huge. So any fluctuation in that brain directly acts because either it is getting overfood or it is not getting food. It's so quick that if you ask any diabetic person, they will realize everyone know that if their glucose level is dropped or getting dropped on, even without telling. Immediately they'll go grab some chocolate bar or something or anything, some water with biscuits to maintain that level. 90% of them are very well aware of these signs because you know your body well than me. So if you are functioning in a pattern and suddenly you feel like there is something is dropping, so there are only two things which can immediately do that. That is your blood pressure and your
Blood sugar.
glucose levels.
Right.
So blood pressure have its own signs and glucose levels have its own signs. So yes, that is one good way to monitor. And second thing, before doing the exercise, you keep a record of your GRBS, what we fasting blood glucose, what we take, and then post exercise, keep it one more time. See, regularly you don't need to do it. But initially, when you start exercise for just say 3 to 5 days, you just keep a track. And if there is any problem, in that, then you keep a track for little more time, or else usually it won't change.
Got
And once in every 1 month, you can take 4 5 days and keep this track before and after exercise too.
Got it. Makes sense. Makes sense. There are three, four more questions, so I'll again quickly get into it. Uh, but I hope diabetes it's clear. But just one thing where I would like to change a little on thought process is most of the time, yes, you are right. We do because I've been diabetic, so I can tell you on that we do feel it going down. But that feeling is actually sometimes when there is a variation of more than 60, 70 or 80 points in your scale. But before that, you don't know much. And the problem
Yeah.
is the GRBS records it a little later because it looks into this thing. So there's a small thing. So
Yeah, sorry to stop here. I want to tell something. Parameters are always ranges.
correct,
Your body can tell if it is a problem or no, even before any other test.
correct,
So if it is 100 to 120 or 90, majority of the times you don't need to worry about it until unless it is actually getting back and maintaining itself.
correct.
You need to worry when it is constantly dropping down.
Dropping down. Yeah,
That is why your body suggests when it is dropping down only, it will tell you, bro, you're gonna fall. Please have something.
something.
For 10, 12 points, it doesn't give you any other indication because, eventually once you're back, it will regain its sugar levels.
Right, but no, but that because you have if you remember as a child when you used to do some kind of activity, we used to have glucose powder
Yes,
ready. But because here your sugar levels, you don't even keep it ready. So typically, chocolate will
true.
take time to release your sugar levels.
True.
But
I
yeah,
think, as you said, glucose powder will act much faster and better if you can just place a small pocket like,
correct. But yeah, anyways, next
yeah.
question. I guess there are three more questions. If I'm not wrong, one is why do I take longer to recover from workout injuries when compared to my other friends? What am I doing wrong? So it's an
Okay, I
interesting
think you should
question.
tell what you're doing wrong.
Exactly, interesting
No, but then,
question.
sorry for the fun, but see, actually, what happens when you talk about recovery, it is not just one single parameter, right? If you are mentally fatigued and you're doing exercise, your recovery will be longer. If you are working or overworking, especially when people go to gym, they overwork a lot. That takes a longer time of recovery. Whether you have a habit of regularly working out or no, or whether you are an occasional working out person, that also will determine whether the recovery is faster or less. And upon all that, even after having all that, if your medical conditions like do you have any anemia or any other stuff, that also makes you recover later. If you don't have proper rest or anything, like for example, if I didn't sleep properly tonight, but tomorrow I'm working out, that also have longer rest periods. The low key one, even if you are having a good amount of sleep, but if you skip some sleeps in between,
Mm-hmm.
like for a week or so, you're actually sleeping on and off. 4 to 5 days, majority of you have slept, but then you still have that innate, tiredness which is there, which you constantly manage by psychological things. Like we don't even know, our body don't react because you need to work, your body will cooperate until unless it is severe. As we spoke, no, it is
Right.
either part that severe, it won't give any indication. So many factors affect like how fast or how slow you recover, and even smallest things like body types also determine, in fact, like how fast and how slow you recover. But if they can have I mean, give me a detail about like when they worked, how they worked, and what kind of rest, what kind of warm up, and what kind of cool down they have done, and all this stuff, if they can tell, I think then I can able to answer their question much better way.
Better.
If they are situated in Bangalore or any other stuff, they are like very good clinics. Like you have InSync Physio, Dr. Abhay and Dr. Sneha runs their sports physios. And even if you are in Hyderabad, you have something called as for neuro athervability, or these are the in Keli, even Belgaum. So there are a lot of places where people are, they can get specially assessed for this. They can actually be assessed for their workout, how they are doing, why they are, what kind of recovery they need based on their type. They can actually tell. So I think I would suggest, like if it is a severe problem, you want to regularly work out, just go and visit any of them, so that it will be a better and faster cycle. But if it is an occasional work, then yeah, you can take suggestions whenever needed.
Makes sense. Makes sense. So now there are two more important questions. So both have cover two different diseases or conditions. One is, can you suggest some exercise for people with cervical spondylitis?
Yeah, the one which we already did. In fact, severe grades, please consult. But then mild to moderate grades, we already spoke about some static exercise, if you remember,
Correct.
pressing it, and then placing a small towel around your neck and taking a chin tuck. So these are the classic exercises for spondylitis in order to start. Once these are started, then you can get into much advanced exercises, which I don't want to disclose here. The reason behind it is, majority of the times when I tell a set of exercise and a time period, so a lot of us have something called a selective hearing loss. We only listen to that stuff which we wanted to. So people end up doing the exercise and getting it more worse and coming back, sir, this has happened. So advanced exercise, you don't want to put it up here, but then for that you can actually contact directly, or through online session. But then for the basic exercise, you can start with statics. That will relieve a lot of pain and even stiffness, and shoulder pushes and shrugs. So these six set of exercises will give a much better outcome.
Outcome. Nice.
Yeah,
Interesting.
for spontaneous.
Interesting. Now, final question that we got from various chats and everything. It was quite a bit actually, but yeah. Uh, do exercises help in scoliosis? It's a very interesting question.
Yeah, very interesting and need to be known also. Actually, there are two types of scoliosis. First, to talk about it, you need to understand these two. One is called structural and one is called functional scoliosis. So, functional scoliosis can be, better with exercises for sure. So, basically, the difference is structural one, the spine itself is curved and fixed. Functional one, because of the muscle imbalance, the spine is curved. So correct the imbalances and keep working on it, and you'll have a very good result with exercises and physiotherapy. In structural one also, if it is in early stages like pediatric ones, they have good results. But if it is in elderly stage, we can give exercise for maintenance, like so that it won't go further into the curve, and other stuff like breathing problems and other stuff, because your rib cage is attached to spine, it also get deformed in scoliosis. So those things can be done, but making the spine straight in structural scoliosis is a surgical part. Maintaining with exercises and getting a little bit of pain relief, not letting it to go further, yes, physiotherapy and exercise can take care of it 100%. And functional, yes, physiotherapy can help, exercise will actually help eventually, because functional is treated with exercise.
Got it. Got it. Got it. So now, so these are like questions that were there. So I would not like to ask a lot more questions. I would like to ask some basic questions, which I know people don't would not ask, but is very critical as well.
That always sounds like a conspiracy, it
It
actually
is. It is. It
not.
is. You know me, so it is conspiracy. Okay, so now this is move from, see, now as a human being we always have functions, right? So one of the major function that every adult has who get married or are sexually active is the act of sex itself, or act of intercourse itself, right? So now in this act of intercourse, you have both male and female partners doing it. And from what I understand, I've been reading a lot about issues around sexual injuries, issues around sexual health, because sexual health does affect your holistic health. So one of the things that I came across through various forums, various questions, etc., is uh, the the cramps, the strains, muscle strains, etc., during the act of intercourse, right? So now, how do we help people have a better sex life due to some simple hacks around exercises or therapy, or if they, let's say, end up having a strain during the activity, though they did not follow but they have a strain, how could that actually how could we help them solve just by exercise or connecting with you online? So how do we do that?
So actually, yeah, good that you asked, because sexual health, even though in today's world, like many are actually open-minded and aware, but still a taboo. Don't nobody wants to actually talk about it. Nobody wants to share about it. Nobody wants to joke about it. In fact, I feel our ancient generations are much better. They literally carved everything on the stones, comparatively us who are actively involved, but then don't want to get to know. So speaking of that, physical and mental health both are equally important in terms of sexual, maintain a sexual health, because it's not a function, it's not an individual function, it's an overall body function when it comes to sexual intercourse, what we talk about, because you need to be fit from both body and mind. So what I would suggest is uh, there is some exercises for your core muscle strengthening. Doesn't everyone thinks core is like abdomen, but not actually abdomen. So your core consists of your diaphragm, your abdomen, your back, and your pelvic floor muscles. So pelvic floor muscles, when they are strong enough, and your diaphragm is strong enough, and your tummy is strong enough, and your back is strong enough, that is where the entire core will act properly, and that helps in relieving a lot of problems which you have suggested. I mean, which you have spoke of right now. Let it be like getting cramps, or let it be the performance issues, or let it be even getting tired faster or something like that. All these issues will be, a majority of them will be solved while you concentrate on this. And second thing is, today's generation have a lot of stress from work, relationship issues or any other stuff. But stress is directly proportional to your loss of potency. It's a fact. So even if you want to, I mean, if people want to believe it or not, like having stress will reduce from cellular mobility to your performance levels. So I always suggest practice meditation, and that would help a lot in any way you can. Practice some sort of yoga or any other stuff, alternative exercises, and please strengthen your core and proper core, and maintain muscle strength and endurance. So these will solve like majority of the problem, not even majority, almost all the problems which we spoke of. And in case they want to consult people, there are a lot of pelvic floor therapists out there. uh, Therapists also, there are a lot of specific therapists who deal with them, and even doctors who deal with them. And in case if you don't want to go into a medical way, you want to go into a stress free way, then yes, you can always contact therapists who are specialized in that. Now females can go more into this obs and gynae physiotherapists and pelvic floor professionals. Both are therapists who can deal with it. For males, you can actually talk freely with the male therapist. So it's easy to get into any good physiotherapist who is in any department. I think they can help because strains doesn't make any difference how they are caused. What is the mechanism of injury? That is mechanism of injury is for us to understand how they are caused, but ultimately the correcting it and giving the exercise it remains almost similar for a lot of them. So
Right.
I think they can openly talk into a private sessions with them so that they have their own privacy. At the same time, they can actually
Makes sense. Makes
perform
sense.
well.
Let's keep it at this point, because what I was thinking is, right now we've gone, of so many topics in a very shallow
Yeah.
way, but we could always do specific segments and then start looking into deeper ways and get the answers, at least with the general questions. But more importantly, we had discussed even earlier, like, when it comes to tele rehab or tele consulting, it always has happened for, it's been happening for medicine, but it doesn't happen much when it comes to therapy. So,
Yeah.
which, and I think the small things can always be done online easily. So that's the reason
True.
why the tele rehab or tele consulting for basic rehabilitation was one of the areas that I thought we should actually start, and so that many people who have problems in very initial stage could take a consult, get it sorted, at least the base levels. I'm not talking about an advanced condition, but let's say someone who doesn't have a very advanced condition could actually take. So that's where this entire segment around telemedicine based rehab consulting is coming a picture, and I'm glad that you agreed to be one of our first therapists to be, being part of this initiative, so that we can help so many people, who and so many preventable injuries, and preventable conditions, because we have an habit that we don't go to a professional till the last moment, and then once we go, it's like, already too late, or already a lot of things have already gone bad. So that is one of the reason why we are looking at this initiative, and thanks for joining in. So now, can you just tell how can people reach out to you? Of course, one is through Zuron as a platform, but even otherwise, how
Yeah.
can they reach out to you, and how could you help many of these people?
So yeah, tele-rehabilitation, as you spoke, that is one of the key things which need to be solved. If you actually see, telemedicine is little bit easier because signs and symptoms-based treatments can be provided with medicine, and medicine they can actually get at home. But there is a the quite a problem with tele-rehab or tele-physiotherapy is uh, even after the assessment, some things need to be assessed manually, like strength and other stuff. Those things are not yet much solved. But a good thing is they are actually being addressed right now. Right? For example, range of motion. I think your company also deals with computer vision tech only, which deals with range of motion assessment. And there are few other companies other than Zuron also deals with similar technologies. I think if we can integrate this into the regular, application stuff, yes, the smaller problems can be easily addressed, especially in terms of posture or in terms of exercise or fitness. They can actually, reduce a lot of musculoskeletal disorders, at least like, majority. I think few of my friends are already doing it, including me, where we actually consult people online and help them to relieve a lot of basic level problems. And it's easy for us to keep a track also, so that patient doesn't need to visit your clinic on daily basis. But that is only for those who are not needed on daily basis. Like for example, take your example. You don't need to come to me on daily regular basis for to getting your posture fixed. I can actually correct it after seeing once. So that also reduces a lot of economic burden on people. At the same time, the availability will be more. And if you want to reach out to me, I can through Zuron is one stuff, and or else you can have a video call directly through me or through International Rehabilitation Services. It's not online yet, but soon it will be. So there are multiple options right now. Post COVID, they have increased a lot. And yeah, we are waiting for you people to include much better tech so that we can work in a faster and much larger way.
Right.
Yeah, these are the few areas, like few places which we can get, like either online sessions or through platforms like you, or a direct call. And clinics are always an option. Like my clinic is in Andhra, where I stay. So everywhere we have therapists available, good ones actually. But please do select the therapist in a proper way. Just don't get to you know because just because someone is just beside you, just don't go there. Check their credentials, check their views, and compare people and go to them. They are very well and very well known and quite a good and experienced people who are there in the field, who can see you much better. Please avoid quacks. That is what I want to end. Yeah.
Yeah, it's true for
We
almost.
just need to spread awareness.
Right, right. It's almost true for almost all medical professions. But yeah, but
Yeah,
just
exactly.
a few more questions. Like, so we at Duron we've been building a lot of sensors. We've been building a lot of tech around it, including computer vision, and we built a complete platform where, to be frank, therapists like you could build digital health applications where so many people could use, etc. Right. So when it comes to strength assessments and muscle assessments, like I'm just trying to kind of understand. Of course, I know that you do some grading based on some activities that they do, etc. So those basic level of grading can be done using both sensors and CVs that we work on. But like like for example, take 1 liter
You
water
know,
bottle. Can you pick it up, hold it, drink
uh,
it, etc., etc.
yeah, I mean,
Example.
sorry to stop in between.
Hmm.
So one really, uh, not I'll say problematic, but a very difficult task about strength is something which varies person to person.
Hmm.
So that needs to be, assessed by a professional itself to know what is an average value. Because, for example, if I test my grip strength, you test your grip strength, you might get like 40 kilos, I might get 45. But both might be normal or both might be abnormal based on what we were earlier. So, because of that, even if you want to try it at home, it makes a little more challenging to acquire strength data. Yeah, but in clinics, you can for sure implement the new age tech to determine, because the one will be seeing a therapist. But when it comes to machines at home, I think that have a lot of false negative or false positive both results, which will alter the course of exercise or prescriptions what we're gonna give. Because every parameter which we assess as a therapist leads to a path. What exactly leads to that is how we tailor for everyone. So for range of motion they are like fixed, so it's easily accessible. Other stuff like mobility and ADLs can be assessed. But when it comes to strength is tricky. But yes, if you can solve it, yeah, I'll also buy it from you.
No,
For sure.
of course, the challenge. I love to work on challenges, but yeah, we'll
Yeah.
see how that works after a little more understanding. But anyways, no, again, as you rightly mentioned, certain things are very easy to do in clinic because because one, there's a fixed position, fixed things, whereas everyone don't need to buy it.
Yeah.
So that we are trying to work those things out slowly, slowly. We'll take
Yeah,
one
and
thing.
especially in a country like India, where we have, we run on an economic basis, right? Even if we don't want to talk about it, like still we run on economic basis. We still, even if you have a car and you are able to move it, around, you still
कितना
check on
देते
10 rupees worth of stuff, whether it is needed or no. That is the mentality we have, which is a good one. So affordability is one thing which we need to keep a point of it. Like, I understood when I did my master's in community, where we deal with people outside the hospital. where where we see the people where there are no facilities. Like I have more than conducted more than 100 camps. We have adopted more than 20-25 villages. We used to do this stuff. Even I do right now. The one thing is affordability, which plays a key role, which is not in the picture directly, but then yes. And second thing is awareness. Even if the equipment is available, like people should know that that is available.
Correct.
So when I talk about clinic, this solves both the problem. You don't need to buy in stuff for like 1,000 or 2,000 for week or 10 days stuff. You can just come there, pay some 3 to 500, 800 or 1,200 based on wherever you are, based on whatever you are going through. You get yourself assessed completely. And then in terms of exercise, you can use platforms like Zuron to monitor your exercise, whether you're doing it properly or no, or you want to assist and you get stats, and that will help me as a therapist and also patient better to perform the exercise at home rather than getting assessed at home, because small mistake can lead to a lot of troubles later. But in terms of exercise, you already know the mistakes and you're correcting it. There are less chances that you might end up getting into trouble.
Correct. Correct. So,
So
no, so
yeah, it's an
basically,
aggregated.
basically at Xeron, that's what we try to do. So assessment tools goes to therapists or in the physiotherapy center or hospitals, whereas at patients and it's more about monitoring progression and supporting the therapy, and it's not about assessing any of it. Because, but yeah, of course, we would obviously reach a stage where we could do predictions and then tell them to go and visit the clinic nearby for an
That's
assessment.
absolutely false.
Yeah, so that's how we are also taking as an approach, first approach, where keeping the physio centers as well as the entire rehab setups in scenario where you could actually have a, just like your full body blood workup and other workup, we have a full
Yes.
body biomechanical analysis or physiotherapy and analysis, something like that. So
Yes. Yeah.
but yeah, it makes a lot of sense. So yeah, so that's, I guess,
Yeah.
we've been on for about 1.5 hours, I guess, and a little more than that.
It's about 2 hours. But it's a good chat because physiotherapy is one of the leading branches and upcoming branches, and it's already came up, I feel. But still, there is a lot of work to do in terms of awareness, in terms of true awareness. What I suggest, uh, that how it's gonna work and what all it solves. And for sure, a lot of troubles which related to your posture or physical strength, endurance or ability or your skill or your psychological issues like distress or your stress, because both mind and body are single entity and they interlink together. So all these things can be addressed in our department, especially in physiotherapy, and we have a lot of branches. We have nearly 11 different branches in physiotherapy currently in India. Might probably go advanced too. So the whole point about this is, please don't check on Google, YouTube, WhatsApp, and get the knowledge, and then come to us fixing, asking to for a quick fix, which is not possible because I have a lot of patients who come after like 6 months to 1 year after the pain started and they want the result in 3 days, which is not going to happen. So it's very clear. Physical needs, in order to damage also will take time, and also regain also will take time. Unless like medicine, where you feel sick today, you have fever today, and your medicine will work today and right now. But physiotherapy is like your spondylitis won't occur today; it will occur like in 3 to 6 months of constant damage to your muscle. So you expect at least 15% of its time, 3 to 6 weeks to get it done.
Right.
So yes, this is the overall conclusion which I want to tell.
No, no, makes a lot of sense. Makes
And
a lot of sense. So that, so we'll figure out later sometime. We'll again have a chat and probably go deep down in
yes,
one of the disease rather than being so above the
absolutely.
surface. But yeah, it was a very good chat. Thanks, Sahith. Thanks for your time.
Yeah, hopefully I
And
have answered like everyone's question. In case if it is good, please tell everyone, and if you are offended, please tell me so that I can correct it. Probably I won't.
I agree. So let's see how this goes, and I hope
Yes.
people are able to find us, and if they have any question, come back to us so that we can connect them to you as well
Uh,
and help many more people solve the simpler problems, if not more complex ones. Let's catch up. Thank you so
And
much.
one last thing, please put a disclaimer in the start, like, all the funny things which has been spoken are out of your own, our own imagination, not to offend any others.
Yeah. We should.
Just to be sure. Yeah.
Sure, sure. So this really,
So it's good.
really helps. Thanks a lot, and thanks
Thank
all
you
the
so much
viewers. I
for.
believe not many have watched live. I believe about 30-35 through the stream, but that's a great number to start with, and I hope more and more people will watch it. As the recording is available
It's
in next couple of minutes.
always a start, and it always starts with the first step. Let's make people more aware, and let's make people more fit and fine, and less stress
Less
to
stress.
everyone.
That's
So I
right.
think,
Well said. Well said. Less stress is
yeah,
the best mantra to be at. And yep. So thank you so much. With this, let's end the stream. And thank you
yeah,
so much once again, Said, for joining us on this call. Thank you.
always welcome, and thank